everybody. Welcome back. Here we are. It's Thursday again, and this is Testimonial Week here on Fire Your MD Now. And by the way, you can check us out at fireyourmdnow.com. And if you'd like to talk to me directly during the show, give us a call toll-free from anywhere in the U.S., 866-582-9933. That's 866-582-9933. Looking forward to talking to you about all things having to do with medicine. And I'm going to give you advice about things that you can do that you have no idea about, things involved with science-based, clinically verified medical nutrition. Because inside of the domain, inside of the world of medical nutrition, there are remarkable healings that are happening all over the country, all over the world right now. But because this profession is so small, because this profession, my profession, the naturopathic medical profession, because we're so eeny-weeny teeny, in order to get our message of health recovery through medical nutrition to the suffering masses of humanity. I mean, just here in the U.S., 350 million something people? Is less than 4,000 licensed physicians like myself in the entire country, less than 300 with more than 20 years of clinical experience. There just aren't enough of us to go around, which is why my colleague, Dr. Wallach, in his wisdom, set his company, Youngevity, up as a networked business. Because with a networked business, we can grow a grassroots coalition of the informed, which is exactly what we're up to here. Why? Because we suffer from two myths in this country. Myth number one is that the MD is the undisputed king and owner of all things medical. Well, guess what? That's not correct. MDs are only trained in one very small aspect of medicine. It's referred to as allopathic, reductionistic, pharmaceutical-centrist medicine. MDs are not trained in medicine. They're trained in pharmaceutical reductionistic medicine, which is good for certain things. So we've been convinced by 100 years of propaganda that the problem with that MDs own medicine and that everybody else is a back-of-the-bus quack. Myth number one. Myth number two, healing is some complicated, sophisticated procedure that can only take place inside multi-million-dollar high-tech hospitals and medical treatment facilities with all this equipment. Oh, my God, it's like an episode of Star Trek. Not really, but you get my point. Well, guess what? That's also incorrect and a myth. Your body knows how to fix itself. Your body wants to fix itself. Your body will fix itself most of the time. If you clean your diet up, stop eating food that is gumming up the works, unwittingly gumming up the works because you don't know any better. And number two, if you give your body the raw materials that it needs to fix itself. It's that simple. If you've got a struggling tomato plant, it's keeled over because you've neglected it. You forgot to water it, forgot to give it fertilizer, and the poor little thing's on its last legs. If you rescue that tomato plant, give it good food, good water, good fertilizer, you think it's going to bounce back? Yeah, it's going to bounce back. Well, look, if a tomato plant can bounce back, can the human body bounce back? Yes. The human body can and will bounce back most of the time, and this is the greatest secret in medicine in the 21st century, is the unheralded promise and clinical successes of medical nutrition. If you knew what I know about science-based medical nutrition, there would be a line of people outside of every naturopathic doctor's office in the United States. I mean, you'd be camped out there like you're camped out to get, tickets for the next, the next concert to come to your town. The promise of medical nutrition is extreme, and it's untalked about in this country because the MDs monopolize everything, and they have monopolized everything for 100 years. Now, it appears as if we have somebody calling in already. Thank you so much. We have Brenda calling in from Las Vegas. We're going to go right to the phones right away. Hello, Brenda. Thanks for calling. I'm Dr. Glidden. How can I help?
I'm a victim of the system, and so I'm a great fan of yours. Let me try to be brief, and I'm not good at that, so interrupt me whenever you need to if I'm going on too long. I'm calling about carpal tunnel. About 10 years ago, I was diagnosed with carpal tunnel, and thank goodness at the time I was seeing an applied kinesiologist, etc., and he said, you don't have carpal tunnel. I went to the best neurologist in Las Vegas, Nevada, 2 different doctors, that you have carpal tunnel. Scheduled surgery. Finally, the applied kinesiologist said, you don't have a carpal tunnel, you have thoracic outlet syndrome. I scheduled the surgery anyway, and he made me feel so bad. I canceled the surgery, went to therapy, let him treat me, beat the carpal tunnel, never had surgery. Now, that was 10 years ago. Now, in 2009, diagnosed with osteoarthritis. The doctor, when he finally told me, and after all the tests, you know the routine, I said, well, what do I do? He said, oh, you'll be fine. And let me go. I even called the Arthritis Foundation looking for what do I do about this. Did not know about you, did not know about Dr. Wallach, did not know about longevity. Okay. Now, long story short, I fought the fight. I did 4 months. By the time I got on your products, I was bone on bone, finally couldn't walk. I had hip replacement surgery. Now, I'm doing fine. I'm on products, and I'll give you the list if you want to know. But the reason I'm calling about carpal tunnel is it seems that it's back with a vengeance. And you know, the only thing they are telling me is an option is hand surgery.
All right. Well, how long ago? All right. Good. How long ago was the hip replacement surgery? When was that done?
It was September and October of last year.
All right. And when did the carpal tunnel come back?
About 2 months after the second surgery.
Okay,
Isn't that
very
right?
good.
It's strange.
No, it's not strange. It's predictable. That's why I asked the question, because here's the deal. Carpal tunnel is a nutrient deficiency, and it's a deficiency in a peculiar little mineral, a trace mineral called molybdenum. Molybdenum. M-O-L-Y-B. M like Mary, O-L-Y, B like baby, D like David, N like Nancy, E, N like Nancy, U-M, molybdenum. It's a peculiar little trace mineral, and when your body runs out of molybdenum, the little sheaths around the tendons in your wrists that keep the wrist lubricated dry out. And it's kind of like a rubber band. When it dries out, you know, it just isn't as flexible as it used to be, and it'll snap like a twig if you pull it too far. Well, it's the same thing. Now, surgery, and more specifically the drugs that they give you pre, during, and post-surgery, waste nutrients from your body. One of the side effects that nobody talks about with prescription medicines is that they waste vitamins, minerals, essential fatty acids, amino acids from your body. They burn them up. They burn right through them. They extract them from your body and you pee them out. So most of the time, there are side effects post-surgery that the surgeon will tell you, of course, had nothing to do with it. Well, you know, like there's a saying, where there's smoke, there's fire. So when you get the return of an old symptom post-surgery, it's because the drugs that you took during the surgery ripped what little nutrients there were out of your body, and then the old condition flared up. So,
okay, let me tell you, I feel blessed because I did try for 4 months to avoid the surgery, and I have been a poster child for this surgery, but it's because I was loaded up on your products pre-surgery. Do you understand?
Yeah, well, that's correct. But, you know, you bet I understand. Now, here's the deal. Sometimes the human body reaches a point of no return. Sometimes it does. And sometimes you need surgery because it's just too late. It's gone too far, right? But I don't know where that point of no return is. Before I started working with Dr. Wallach, I used to think I knew where it was, but I have seen such remarkable things happen on Dr. Wallach's protocols that, for goodness sake, I have no idea where the body's point of no return is. Now, there are only 2 conditions under which medical nutrition doesn't work. There's only 2 conditions. Well, 3. Either you're dead. That was a joke. The second thing is...
Okay, I'm laughing.
if you're not absorbing the nutrients or you're not taking enough of the nutrients, right? You're either not taking enough or you're not absorbing what you're taking. So everybody with a chronic health condition, especially if it's really bad, like bone-on-bone arthritis, needs to be on the gluten-free diet. So are you on the gluten-free diet?
Not strictly.
Well, then that's part of the problem. No. It's got to be strict, because here's the deal. I want you to visualize a bucket. And if that bucket contained all of the nutrients that your body needed, and, was if we were trying to fill that bucket up with water, which, in this example, is all the nutrients that your body needs. If there's holes in the bottom of the bucket, we're pouring water in the top, we're pouring nutrients in the top, and they're leaking out the bottom, right? So in order for medical nutrition to really work, you have to plug up the leaks in the body, so to speak. And what's mandatory in this case for you, and I mean mandatory like your life depended on it, because it kind of does, you have to be 100% gluten-free. And I don't even want you downwind of anybody frying food. I don't even want you looking at fried food. 0 tolerance for fried food, 0 tolerance for wheat, barley, rye, and oats. Now, what's your body weight, Brenda?
Well, I am overweight now. This is recent. I'm at 112. I'm normally 105 to 103 pounds. I am 5'1".
Okay, so at 112 pounds, we're going to round that up to 120. We're going to divide by 10. That's 12. So that means you need 12 glucogel capsules a day. You need 4 with breakfast, 4 with lunch, 4 with dinner. Were you doing that many glucogel capsules?
I happened to see Doc Wallach a couple of months ago in Vegas, and he put me on 15.
Well, even better. But before you had the surgery, were you taking 15?
No, sir.
See, this is it. This is it. Oh, I'm going to pull my hair out, right? If you're not taking enough, or you're not absorbing what you're taking, you're going to get limited results. So that's what you need. Stick with me, Brenda. I'll pick this up on the other side of the break and dial this in for you. Ladies and gentlemen, I'm Dr. Peter Glidden, and this is Fire Your MD Now. Give us a call, 858-666-582-9933. That's 8. Welcome back, ladies and gentlemen. I'm Dr. Peter Glidden. It's your lucky day. This is Fire Your MD Now, and you found us. You found your way to good health. Let me tell you, I've been a licensed naturopathic physician for over 2 decades. And it's pretty easy to get good results with holistic medicine, because what are you doing? You're supporting the body's ability to fix itself. It's kind of a no-brainer, right? It is the best-kept medical secret in the United States. And in the last 3 years, I've been exclusively following my colleague Dr. Wallach's protocols and using Dr. Wallach's health recovery products exclusively. And since I've been doing that, I don't know what planet I'm on anymore, because the things that I've seen people recover from with Dr. Wallach's methods are extraordinary, and they eclipse anything that I had been previously exposed to. Now, we're talking to Brenda in Las Vegas about a number of things, but really, basically, Brenda, the take-home message here is, in order for medical nutrition to work, you have to be taking enough of it, you have to be taking the right stuff, and you have to be absorbing what you're taking. So, if you had an infection, a sinus infection, and went to an MD and they told you needed Cipro, 30 milligrams 3 times a day, well, if you took 10 milligrams once a day, it wouldn't work. Now, that doesn't mean antibiotics don't work. Holy smokes, just means you didn't take enough, right? So, 15 glucogel a day. Also, I'm going to recommend 1 bottle of Beyond Tangy Tangerine a month. And what would be best for you is the Cal Toddy instead of the OsteoFX Plus. You should be taking a liquid calcium supplement called Cal Toddy. C-A-L-T like Thomas, O-D-D-Y, and that's a longevity supplement, Cal Toddy. So 1 Beyond Tangy Tangerine, the Cal Toddy for bone-on-bone would be 1 ounce twice a day. So you'd need 2 Cal Toddies a month. 1 ounce of the Cal Toddy in a little bit of orange juice or a little bit of water twice a day. You also need 2 bottles of liquid plant minerals. 2 bottles of liquid plant minerals. I want you to take 1 ounce of the liquid plant minerals twice a day. And the Beyond Tangy Tangerine red powder, I'd like you to do 1 level scoop in 16 ounces of water, one level scoop in 16 ounces of water twice a day. And every time you make that solution, I want you to take at least 30 minutes to drink it down. At least 30 minutes to drink it down. And the last thing that you should be doing here in order to support and promote healthy bones and joints, healthy tendons in your body, is the selenium. And at 100 pounds, I would recommend you do 3 bottles of selenium a month. That's 3 capsules 3 times a day, 3 with breakfast, 3 with lunch, 3 with dinner. So if you do that, the 15 glucogel a day, and dial in the gluten-free diet, your hip is going to tighten up so much, you're going to be like Superwoman, and they're going to write medical reports about how fantastically you survived the surgery and you maintained that prosthesis. Because, you know, if you don't fix the problem, even when you get a fake knee or a fake hip or a fake shoulder or a fake whatever, the problem's going to come back. It's just a matter of time, just like the carpal tunnel. So the fake hip starts wiggling around in there, right? So when you nutrify, life is good, man. Everything gets better. I tell you what, you're going to love how you feel. And most people, when they dial in the gluten-free diet 100%, feel a noticeable difference within the first 14 days. So, you know, it is a little bit of a pain in the you-know-what. But what the heck, it's not that big of a deal. So you have the hamburger, no bun, right? You have the cheesecake, but not the crust, right? You don't have the fried food, you have the steak instead. I mean, yeah, really, that's really a tough choice, right? So it's not a difficult thing to do, but it is something new that you have to get used to. But you really need to focus on this, Brenda, or you're playing with fire. And there's a... You're going to take the nutrients in one end and leak them out the other. Make sense?
All right. I have a question for you, because let me tell you what I have in addition to what you've already suggested. I've been taking the OsteoFX. You've said...
we only have a minute and a half left, so hurry it up. Okay.
I've been taking the plant-derived minerals, Z-Radical, Tropic Sensation, Hempol, and Prosilivus Plus.
You don't need all that.
Plus the De-Stress.
You don't need all that.
And the EFA.
You don't need all that.
And the enzyme.
Don't need it. You need the Beyond Tangy Tangerine, the EFAs, the Cal Toddy, the liquid plant minerals, the glucogel, and the selenium. That's it, plus the diet. Now, anything else you want to add on, I'm okay with. You know, you should see how I take 18 vitamins twice a day. Because I'm one smart son of a gun, and I'm trying to prevent stuff in addition to maintaining my health. But that's a good foundation for you to start with. Dial it in.
Wait a minute.
You're going to love how you feel. We're out of time, Brenda. We're out of time. This is Dr. Peter Glidden, ladies and gentlemen. Stay tuned. I'll catch you. This is Fire Your MD Now. Check me out at fireyourmdnow.com. That's fireyourmdnow.com. If you'd like to talk to me live, give the station a call toll-free at 866-582-9933, 866-582-9933. You're not going to believe what I just pulled off of the Internet. Retired pro hockey player first to receive total artificial heart in upstate New York. This is tremendous technology that can have a dramatic effect on patients who are experiencing advanced heart failure, says H. Todd Massey, M.D., surgical director of the blah, blah, blah artificial heart program who led the surgery. Orlando was diagnosed with a rare disease known as sarcoidosis. Sarcoidosis is a relatively easy thing to take care of with holistic medicine. Sarcoidosis is an essential fatty acid deficiency, a multiple mineral deficiency, and there can also be problems with the sarcoid tissue in the lungs, specifically aggravated by all of the wrong food. The article goes on to say that this led to heart failure and caused potentially fatal arrhythmias. No, it did not. The arrhythmias happened at the same time that the sarcoidosis did. They're completely unrelated. Most of the time, when you get a funky beat in your heart, which can be life-threatening, you know, your heart beats too slow, then it beats too fast, then it beats really fast, then it beats too slow, then it beats really, really fast, and there's no controlling it. Most of the time, when that happens, the heart is completely fine. The problem is the nerve transmissions going to the heart. Where do the nerve transmissions come from? They come from the spinal cord. What is causing the problem? Most of the time with arrhythmias, of this extent. The problem isn't the heart, it's the intervertebral discs that cushion the nerves, plural, as they come out of the spinal cord, going to the heart, going to the bladder, going to the lungs, going to wherever they go. When the cushions in the disc, which are like feather pillows, have lost their feathers, the nerves that come out right there get squished and pressed on by the anatomy of the body. And when they get squished and pressed on, funny things happen to the nerve transmissions. You know what it feels like when you hit your funny bone, right? Your fingers start tingling. Well, when those nerves going to your heart, which regulate the heartbeat, get squished by degenerative disc disease, guess what? You're going to get a funky heartbeat. And this guy was a hockey player. He was 41 years old. 41 years old. They gave him an artificial heart while they're waiting for a heart transplant. They gave him an artificial heart. It's unbelievable, and they're touting this as remarkable progress. If this guy was my patient, we could have fixed the arrhythmia in 6 months. Wouldn't have had to rip his old heart out. Well, nothing wrong with the heart, but this is how the MD thinks. As God is my witness, the MD is a colorblind art critic. They are completely enamored of their own position. They are completely enamored of their own point of view. And they will not give it up for anything else. And they develop remarkable, breathtakingly remarkable heroic interventions. Oh, an artificial heart and everybody's happy, right? Yeah, I don't think so. It's one thing if you're in Iraq and you get shrapnel in your heart like Tony Stark, Iron Man, and you have to have some type of mechanical intervention to keep the heart alive, that's one thing. But when there's organic change to the heart, 99.9% of the time it's related to medical nutrition. And guess what? He's a hockey player. Guess what? Hockey players and professional athletes are some of the most unhealthy people on the planet because couch potatoes live longer than professional athletes. Did you know that? Did you know that there's never been a professional athlete to live to be over 100? Well, that's a lie. There was one African-American guy from the old Negro baseball leagues, but he was it. If exercise was so healthy and so beneficial to the human body, then you would think that professional athletes must be the most healthy people on the planet. They certainly should be the longest-lived people because, for heaven's sake, they are paid to exercise. Well, they're not. Why aren't they? Because everybody's nutritionally deficient. And by everybody, I mean everybody. Now, when you have an athlete and they're nutritionally deficient, they're going to be burning through their reserves that much faster. If I had two automobiles and they were exactly the same year, make, and model, and they both had, 50,000 miles on them, they both needed 8 quarts of oil, but they both only have 2. If both of the cars are exactly identical and they are both down 6 quarts of oil, if I drive one of those cars at 10 miles an hour and the other car at 100 miles an hour, which one is going to burn out first? The one I'm driving at 100 miles an hour. It's the same when you exercise. Exercise without nutrition is suicide. Suicide. Let me say it one more time. Suicide. And that's what happens all the time. And then the medical doctor says, oh, it must be a bad gene. He must have had a bad gene. Guess what? No, he didn't have a bad gene. He had a bad doctor. And guess what? In the 20th century in Europe, cardiomyopathy heart and enlarged hearts, which is one of the things that happens when you exercise too much because your body runs out of the mineral selenium. Cardiomyopathy, enlarged hearts, are caused in large part by not enough of the mineral selenium. Selenium, that's S-E-L-E-N-I-U-M. And in Europe, in the 20th century, enlarged heart was called athlete's heart. It was called athlete's heart because the majority of people that they did autopsies on after they died who had enlarged hearts were athletes. Athletes are prone to getting these things. Why? Is there some athletic gene? Or all these athletes have the same gene that causes an enlarged heart? Well, your medical doctor would have you believe so. But it's not. It's a simple selenium deficiency. Why doesn't your MD know this? Because your MD is a colorblind art critic. Your medical doctor isn't trained in medicine. Your medical doctor is trained in pharmaceutical medicine. And pharmaceutical medicine is one small piece of the medical pie. It's a really small piece. But they have convinced you and everybody else in this country that that one eeny-weeny-teeny piece is the only piece that's worth looking at. And all the other pieces are quackery. Right? And we've bought it hook, line, and sinker. And this is a big problem here, folks. This is why everybody, especially athletes, needs to supplement. They need to supplement. But again, I don't want you to believe me. I actually do want you to believe me. But in order to drive my point home, because this is Testimonial Week, we're going to hear it from the horse's mouth. We have David with us from Illinois to talk with us about his experience with medical nutrition. David, thanks for calling. Are you there?
Hey, Dr. Glidden.
Hey, David, thanks so much for logging in here. I appreciate your help. So give us a little bit of your history. How old are you?
I am 19 years old.
19 years old. You're currently a freshman at Loyola University, correct?
That is correct.
And you got a full boat scholarship, if memory serves me correct. Is that correct?
Just about, yes.
Oh, all right. So that means you are one smart young man, and you're in the pre-med department. Is that what you're studying at the University of Loyola?
Yes.
All right. Very good. Now, you were born with type 1 diabetes. Is that correct?
Correct.
Okay. So before you did medical nutrition, which you started about 3 years ago, tell everybody what your experience with your blood sugars was like.
Blood sugars were very up and down, very chaotic for me. I was actually diagnosed a hypersensitive type 1 diabetic due to how many seizures I was having from my diabetes, along with the massive amounts of insulin that I was taking into my body.
So give us an example. What was your daily dose of insulin before you did medical nutrition?
Daily dose of insulin was somewhere between 200 and 300 units a day, according to how much I ate.
All right, 200 to 300 units of insulin a day. Now, for the listening audience, type 1 diabetes, you can't reverse that, because in type 1 diabetes, your pancreas has burned out the cells. The cells in the pancreas that make insulin are no longer there. There's a little window of time in the first year of life when we can intervene and perhaps make a difference with a type 1 diabetic. But once that window is closed, it's closed. And whoever has type 1 diabetes must be taking insulin injections every day just in order to live. However, insulin is a tricky little molecule, because if you take too much of it, over time, you're going to lose your fingers, lose your toes, lose your feet, lose your hands, lose your vision, which is what happens to diabetics as a result of too much insulin use over time. Your body can't handle it. So what we want to do with type 1 diabetics is cut them way down on their use of insulin. And if we can do that, everybody's happy. So how many years ago, David, did you start up with medical nutrition?
I started listening to all this and practicing it almost 3 years ago, about 2.5.
And when you first started, you were only able to afford one of the supplements a month. Is that correct?
That's correct.
And that supplement was called Sweeties, which is our secret sauce to support and promote healthy blood sugars. It's $24 a month for one bottle. One bottle of the Sweeties, the Longevity Sweeties. And when you started taking the Sweeties, what happened to your insulin levels?
Oh, my goodness. It was ridiculous. I felt like, well, for one, I was low a lot. My blood sugar went down because I didn't realize how fast the change would happen to my insulin scale. In a matter of 2 days, my insulin scale went from about, 250, between 200 and 300 units of insulin to between 75 and 150 units in 2 days.
And so that's a half of a reduction. It's 50% reduced. So what is it today, 3 years later?
I take about 25, 30 units of insulin a day.
Okay, so before medical nutrition, you were doing average of 250 units of insulin a day, and now, 3 years later, you're averaging 30 units of insulin a day. Is that correct?
That is correct.
You are the man. Now, how do you feel since you switched over to medical nutrition? What else has happened in your life?
A few other things. Going gluten-free, actually, I found out I had digestion problems that I wasn't even aware of beforehand, that just going gluten-free fixed for me. That was a fantastic thing. I had ADD for a while. That's out the window. I'm no longer hypersensitive type 1 diabetic. I have not had a seizure since before I started the sweeties. And my brain is it seems more organized, and my memory functions better. I'm able to recall things and remember things better than I could before.
Unbelievable. So no more ADD, no more hypersensitive diabetes, no more seizures, and your insulin use has gone from an average of 250 now to an average of 30 units a day. Ladies and gentlemen, this is the potential of medical nutrition. I've said it before, I'll say it again, as God is my witness. You do not know what you're missing. Go to fireyourmdnow.com, click on the Join Us link, and find out how you, too, can experience the wonderful benefits of science-based, clinically verified nutrition. Welcome back, folks. Dr. Peter Glidden here with you. Welcome back to Fire Your MD Now. We're talking to David from Illinois. David's a 19-year-old freshman at Loyola University studying pre-med on a scholarship. Was able to reduce his insulin intake from between 250 to 300 units a day to 20 to 30 units a day with medical nutrition. Now, David, your family physician, when he saw these numbers come down, what did he say?
My physician, originally he didn't notice. More or less, he was just kind of just blindsided by it. The MD didn't ask. The MD didn't, no questions. It was, I walked in. The MD was like, "Oh, you need more insulin." They took my A1C, and things were done. So very closed on that level.
So basically, no feedback at all, right?
Exactly.
All right, and ladies and gentlemen, he didn't call me, and this is what I was alluding to before. I've been doing this for 23 years clinically, and I am still waiting for the first phone call from an MD who had previously been treating someone for years. I get a hold of the person for whatever reason. I take care of the problem in a number of months. It goes away. They go back to their MD. The MD sees the before and the after results and doesn't call me. This is the fundamental problem that we have in the United States. This is why Alex Jones was right. It's a prison planet. Because these people are completely in control of our health, and they are completely incompetent into the bargain, and yet we genuflect at their altar every single day. You know how many people there are like David in the world? How many people are struggling with their insulin? How many people are cloudy in their brains, have epileptic seizures, have all kinds of problems because their blood sugar levels are untaken care of? Why are they untaken care of? Because they went to the wrong doctor. Period. Now, it's stuff like this that really gets my dander up, because if David had not met me, he met me when he was 16 years old. If he hadn't met me, I doubt very much he'd be in college right now, because he wouldn't be able to think straight, wouldn't be able to concentrate, wouldn't be able to remember stuff, certainly wouldn't have gotten as good grades as he did and get the scholarship that he did. This is important stuff, and everybody misses it. And that's why we are building a grassroots coalition of the informed, which leads me to the next question, David. How is your longevity business going, and how many people have you enrolled in the last couple of weeks?
The last couple of weeks have been pretty good for me, actually. I think last 2-3 weeks I've signed up 7 people.
7 people, and you're 19 years old. Now, what's the average age of the people that you're signing up? Are they your contemporaries, teenagers and in their early 20s as you, or are you signing up adults?
I've signed up a couple adults, but the general person is people my age, people looking, lose a little weight. They have one problem or another, or they're just interested in health and they want to know what's going on.
Right. Fantastic. Well, look, man, good for you. I'm telling you, ladies and gentlemen, David at Loyola University in downtown Chicago is a rising star in the longevity family. You better keep your eyes on him because he's going to pass you in the fast lane if you're not looking out. Thanks so much for calling in, David. I appreciate everything that you do. Keep up the good work. Ladies and gentlemen, this is it. There are 2 ways that you can deal with us, 2 ways you can interface with us. You can call us up. Call 855-347-3696. That's 855-347-3696. That's my number. That's Dr. Glidden's number. Leave a message. I'll get back to you, and I will tell you specifically for free Dr. Wallach's health recovery methods for your condition. Visit fireyourmdnow.com. Sign yourself up. Get informed. Take your health back. And what I really want you to do is join our cause as a longevity business builder. Because not only are we deficient in 91 essential nutrients, everybody in this country needs a little bit more vitamin M money. We're going to be talking about that tomorrow, and I have a testimonial you will not believe. Tune in tomorrow, 4 o'clock Central Time. I'll see you then. Keep the faith.